Welcome. Today we have a big announcement to make, and then today we plan to conclude with a question and answer session for the press on the line. It has now been nearly 2 weeks since the Tennessee healthcare community first told Governor Lee what he must do to save lives. Governor Lee's failure to act early, while also undermining the efforts of many city mayors, has created confusion that has allowed the COVID-19 problem to only get worse. Governor Bill Lee said that the medical community was divided on the importance of a stay-at-home order to save lives, and suggested that he has a letter from some doctors saying his half measures are enough. But Governor Lee, is your letter signed by leading health experts in our state, by 2,000 physicians, 30,000 Tennessee citizens, and 9,500 medical professionals represented by different medical societies? Let me just review a few of the names on our petition. Dr. David Aronoff, Division Chair of Vanderbilt Infectious Disease. Kevin Michael Smith, President-elect of the Tennessee Medical Association. Dr. Elise Deneny, Governor of the Tennessee Medical Association. Adele Maurer Lewis, Medical Examiner for the state of Tennessee, and 2,000 other physician petition signers, along with 9,500 other physicians and healthcare providers represented by their different medical societies. A stay-at-home suggestion is not a stay-at-home order. Governors order their people to leave their homes in hurricanes. What we're doing is we're asking Governor Lee to order people to stay home during this pandemic. Let's talk briefly about why this is so urgently needed. During Governor Bill Lee's press conference on Tuesday, he said that the state is looking for surge hospital beds in convention centers, hotel ballrooms, college dormitories. Pop-up makeshift beds are not ideal conditions for healthcare workers who are already strained, and it's even worse for patient care. The doctors and nurses who are left will rise to the occasion. But why would we not want to take every step possible so that we can prevent a worst case scenario? Again, the best action, the best course of action 13 days ago is still the very same today. Limit the need for drastic measures by ensuring that more people stay in their homes. Governor Lee, other Republican governors are listening to their health experts. Governor DeSantis, Governor Kemp, Governor Hogan have all put saving lives ahead of everything else. And they understand that lives and the economy are intertwined. You cannot save one without the other. Months from now, people will applaud the leaders who took bold steps to save lives. But there will also be a response for those who were entrusted with power, but blinked when warning signs flashed, and they refused to use the life-saving tools available to them. Now we have 2,000 physicians signing our first letter back on March 20th. We have 9,500 members of different medical societies and 31,000 citizens of our state. Last night, we heard that we can now add one more doctor to our petition to Governor Lee for a mandated stay at home. And at this time, we would like to invite everyone to watch. Our movement of doctors, healthcare workers, and the citizens of our state now includes Dr. Bill Frist, former United States Senate Majority Leader, Republican, and a renowned heart and lung transplant surgeon. Let me explain why this is such an important addition to all of those listening in today. Dr. Bill Frist, adding his name to our petition, shows Governor Lee within his own party leadership that a leader in that party leadership now acknowledges that lives and the economy are intertwined and you cannot save one without the other. Bill Frist joining the 11,500 Tennessee medical professionals calling on Lee to heed the warning we've been sending for nearly 2 weeks delivers an even stronger message that the medical community is united, the citizens of our state are united, and now members of his own party are joining others in uniting behind a mandated stay at home to save the lives of Tennesseans. This will now conclude our signing ceremony, and I will take a few questions from the press today. Before I do that, I want to again thank all of the physicians on the petition, but especially the physicians that joined me today for this signing ceremony. Justin.
If you have a question, please raise your hand on the phone. It looks like our first one is from Brett Kelman. Go ahead, Brett.
Hi, everyone. Thanks again for being available and taking our questions. It was great to be on the line and be able to watch Senator Frist sign the petition, but I would really like to hear him or see him just to make absolutely sure that he's participating. Is he available? Can he come onto the call?
I think, Brett, that probably is a question for his staff. I mean, you certainly have ways to reach out to his staff. I can't speak for Bill Frist. I would hope that he would, now that he has publicly signed the petition, that he would be available for comment later today. Any other questions?
We have Stacy Case. Go ahead, Stacy.
Has the governor responded to your letter or any of your public outcry at this point?
The only thing that we see is his daily press briefing. We get messaging from the governor through that press briefing, but no, Governor Bill Lee has not reached out in person to us. That has not occurred.
Andy Sher, we have another question. Go ahead.
Yes. So how long have you all been talking with Dr. Frist about this? And I know that he's done a lot on Twitter and on, he's got these podcasts and has been talking a lot. But I mean, did you have to do much convincing, or is this, how did this come together?
This came together through an email through Dr. Bill Frist last evening. So this is an incredible opportunity. I think it says that that yet another physician, put all politics aside, yet another physician believes that we need to mandate the stay at home. As you know from multiple news reports today, Tennessee is among a very few select states that are still not mandating a stay at home. And again, we've been requesting this for now for essentially 2 weeks. And I personally believe that our time is short. And if we don't act quickly, we are going to be passing the point of no return at some point this month.
Thank you.
Thank you.
It looks like we have another question from Stacy. Go ahead, Stacy.
Yes, is Dr. Michelle Wather able to talk? Is she able to answer questions?
Justin.
They're just watching in remotely right now.
Okay, so they're not able to talk back and forth?
Yeah, we'll be able to set up other interviews with other physicians afterwards.
Okay, then I will direct this question to Dr. Millstone.
Please.
you can go into a little more detail about what it would be like to work in a convention center, triage type surge setting, if you could talk about the actual challenges in detail.
I can talk firsthand about that. I have physician friends all over the country, in New York and New Orleans and Baton Rouge and on the West Coast, that are already working out of their element in these so-called surge hospitals that have been set up last minute to try and take care of the overload of patients. You have to remember that when you take healthcare workers out of their usual environment, it creates very chaotic scenes. It's difficult to find equipment. It's difficult to ensure patient safety. It's difficult to ensure quality medical care when you're not in your usual environment. And you have to remember, if we assume the federal government is correct and that 15 to 20% of healthcare workers are going to be out of work because of the infection, who is going to staff these surge facilities? And what you're seeing across the country is calls for retired nurses to join the fight, retired doctors to join the fight. Yesterday, a friend of mine who's a cardiologist texted me and said, "Oh my gosh, I'm going to have to probably manage a ventilator, and I haven't done that in 20 years. So not only is the element of the facility poor, but you're also going to have to rely on many healthcare workers who are not used to caring for patients on life support, who are not used to caring for patients on ventilators. And I think it's a prescription for disaster. And we've seen that all over the country. You know, there are certainly great medical societies that could put field hospitals together quickly. But my question is, if 15 to 20% of the healthcare workforce is not available, who is going to take care of you if you're on life support? Do you want a dermatologist or an ophthalmologist or a cardiologist managing that equipment when the intensive care physicians, the pulmonologists are stretched so thin because we weren't able to stop the tide of patients with this illness?
All right, any other questions? Raise your hand in the Zoom. Okay, we've got another one from Stacy. Go ahead, Stacy.
Yeah, final question here. Are you saying if we did have a mandatory shelter in place order that's enforceable, that we could avoid these surge hospitals being set up in convention centers, so on and so forth?
Great question. If you listen to Dr. Deborah Birx, or Dr. Tony Fauci when they were next to the president 2 nights ago, they displayed the IHME model of how many beds we will be short in the country and how many ICU beds we will be short in the country. If you believe in that model and you go to that model, the state of Tennessee will be short 1,800 ICU beds later this month. The model also has a very important criteria to it that Dr. Birx pointed out. When you put in the model that we have all essential businesses closed in the state of Tennessee, you are assuming 100% compliance, that all non-essential businesses are closed. And like Dr. Birx pointed out in the White House press briefing, Americans cannot get to 100%. So 1,800 bed shortages in terms of ICU beds in the state of Tennessee, that's the very least number of ICU beds that we're going to be short. And that assumes 100% compliance with school closures, non-essential business closures, a mandated stay at home. A mandated stay at home flattens the curve, and a mandated stay at home has been put in place by countless other states in this country. There are very few states now that do not have a mandated stay at home. So you must say that all of those other governors, all of those other health advisors, all of those other leaders feel that a mandated stay at home is better than urging people to stay at home.
All right, next question is from Lauren Snowden. Go ahead, Lauren. Oh, try now. You should be unmuted. Go ahead, Lauren. Lauren, you should be unmuted. All right, we will try her again in a second. Any other questions, please raise your hand on the line. All right, not seeing any others. We will make several physicians available for interviews for the rest of the day, and we'll be available for follow-up with them as well.
Thank you all for attending.